Our goal here in British Columbia is to ensure that people are getting the help that they need when and where they need it.
BC's Health Minister, Premier and Attorney General say proposed changes to the Mental Health Act will strengthen involuntary care. Advocates have been calling for updates to the Act, in place since 1964. The province says the amendments are meant to better protect healthcare workers who are worried about being sued.
It changes the language from an archaic language, an old construction that said the patient was deemed to have said yes, the patient was deemed to have consented, and therefore the healthcare workers are protected.
The province has moved legislation to update a section of the Act which outlines deemed consent. That provision is being challenged in BC Supreme Court. Groups argue it denies patients the ability to consent to treatment.
It isn't feeling immediately clear as to whether what the impact will be of removing 31(1). And I guess the big question for us in the mental health, community mental health space is, if it's removed, will it change practice currently?
Healthcare experts also wonder if frontline staff need more legal protection.
The Act already includes liability protection under Section 16, and that basically protects those authorized to provide treatment if they're acting in good faith and with reasonable care. So it's a bit confusing to me.
In 2022, the government amended the Mental Health Act so people involuntarily admitted can get support from an independent rights advisor. The Premier says the proposed changes will not make the court challenge irrelevant or impact the court's ability to make a decision. Amelia John, CBC News, Vancouver.